Good afternoon. My name is Jim Weatherup. I'm the chairman of the Oswego County Legislature. Joining me today are Dr. Christina Lipke, Oswego County Health Department Medical Director, Phil Church, County Administrator, Diane Oldenburg, Senior Public Health Educator, and Katie Paglaroli, the Director of Clinical Quality at Oswego Hospital. The purpose of this news conference is to bring you up to date on the COVID-19 situation in Oswego County. Thank you for your participation. Thank you for we recognize that this is a trying time for all of us, and we appreciate your patience and cooperation. First, I want to address the misinformation that was communicated during the governor's news conference this morning. As of 2 p.m. today, there are no confirmed cases of COVID-19 in Oswego County. We believe the 2 cases from Hastings-on-the-Hudson and Westchester County were attributed to Oswego County in error. As of 2 p.m. today, there are 91 people who have been tested or who are scheduled to be tested. 52 people are being monitored, and we have 0 positive cases. I want to assure you that we have a very competent team of medical and emergency response professionals working with Oswego County government and agencies across the county. I ask you to please refer to credible sources of information, including the Oswego County website and Facebook pages. And also, we encourage county residents who have questions about COVID-19 to contact the Health Department hotline at 315-349-3330. I also, at this time, would like to introduce Mr. Phil Church, County Administrator.
Thank you, Mr. Chairman. Also with us today is Public Health Director Jianxing Huan. Oswego County Health Department is the lead response agency in this incident. In anticipation that Oswego County will eventually be touched by coronavirus, our departments, first responders, and healthcare providers have been preparing since it became apparent that the pandemic would reach America. Oswego County Health Department, as I said, is the lead response agency. The county activated our Emergency Operations Center a week ago to help coordinate response and preparation activities among health and human service agencies, law enforcement, 911, fire and emergency medical services, and public information. As we all know, there is a shortage of personal protective equipment, or PPE, throughout the world. Oswego County is no exception, and acquiring PPE is a priority. The county supplies PPE to frontline first responders and healthcare workers as we receive it from the state. However, to increase our supply, we are asking all retailers, distributors, and manufacturers of PPE in Oswego County to contact the county and offer us the right to purchase PPE before you offer it for sale, so that we can get those critical supplies to our frontline workers. PPE includes face shields, safety goggles, N95 masks of all sizes, surgical masks, disposable gowns of all sizes, nitrile and latex gloves, Tyvek suits, all sizes, including hoods, booties, shoe covers. Also, touchless thermometers and thermometers with their probe covers. If businesses have PPE in stock, or as you take deliveries in the coming weeks, we ask you to call 315-349-3260 to arrange procurement. Thank you. I'll turn it back now to Chairman Weatherup for questions.
Thank you. We have a number of questions that people have called in with. Our first question would probably be for Katie Paglaroli. Where are people being tested in Oswego County?
Thank you. Currently, we have a testing site in our main Oswego Hospital campus at 110 West 6th Street. In order to be tested within Oswego County, you need to be scheduled with an appointment. In order to get an appointment, you need to be screened by your local primary care physician or call the local health department. They are currently setting up the appointments for that testing. If someone does come to our emergency department urgently and they meet the criteria for testing, then they would be tested. But if they have mild to moderate illness, they may be sent home and scheduled with testing at our mobile testing site.
Thank you. Another question that has come in is, what does it mean when someone is under isolation? I would refer this to Diane Oldenburg.
Hi, county residents that may be undergoing monitoring by the Oswego County Health Department may be under, right now, all the people that we're monitoring are under precautionary quarantine, which means that they're being monitored for signs and symptoms of illness, or they may have been tested and are awaiting test results, or they could have been traveling from another country that has sustained COVID-19 cases going on. So those folks that are being asked to be under precautionary quarantine would be asked to stay home, to monitor themselves for signs and symptoms, fever, cough, and they're checked on daily by the health department to make sure there's no changes in their health status.
There's another question. People want to know if they can go outside with their kids or to a park or playground.
Absolutely. Right now, the governor has waived fees for state parks, so it is encouraged. Why we still encourage people to try to keep that 6 foot of social distancing among folks when you're out in public. It's perfectly okay to go outside to, have the kids ride their bikes, go for walks or hikes, play tennis, whatever you want to do to get some relief from being inside and get some exercise. But again, we encourage people to keep that social distancing when they are out in public.
Thank you. Another question that's come in is, what should people do if they have symptoms? And I would defer to Dr. Lipke from the Oswego County Health Department.
Certainly, if you have symptoms, we'd encourage you to call your physician. If you do not have a physician, I would encourage you to call the Oswego County Health Department.
Any other questions?
Phone number.
The phone bank.
Phone number.
Oh, the phone number to call in. We touched on that earlier. We encourage, again, county residents who have questions about COVID-19 to contact the health department's hotline at 315-349-3330. Any other questions? All right, I'd like to thank you all for attending, and we'll get through this. Stay calm. Thank you.